down right here facing this way. We're going to do a little bit of exam first on the bicep here. Okay. So you've been playing baseball for how long?
13 years.
13 years. And so you felt that tenderness in there for how long?
About a year.
A year. Do you feel it when I press here?
Yeah.
Yep. Do you feel it down into here or down into here?
It's more on that side.
This side?
Yeah. Yeah, that.
Okay. So you feel it more in here or more over here?
Like a pinching feeling?
Yeah.
I think it was more down here, actually. Yeah, it's a good bit down there.
Does it go down to your pinky at all?
No.
No. Does it go down into here at all?
No.
Okay. Put your hand like this for me, and I want you to come up this way.
Come up this way?
Yep. Any pain with that?
I know what you're doing. Like, usually when I curl like that,
yeah,
there's a lot of pinching right there.
A lot of pinching there. Now do just the wrist. Hang on. Let's go ahead and go back down. Go ahead and go. Any pain with that?
No.
No. So when we're trying to get in there, we have that bicep tendon right in here that's having the issue. Okay.
Yeah.
So with something like this, this is probably going to be an overuse tendonitis, right? Because it's right at the tendon, right? It's not inside the muscle belly. So the muscle belly is, let me show you the difference. All right, so when we look at the bicep tendon, come check it out. There's a couple of things because you're having it on the pinky side, okay?
Yeah.
So look at the tendon that's right here. That's going to be this that goes all the way down here, a palmar tendon. The bicep tendon comes down to the opposite side, as I was showing you earlier. So we have some inflammation right in here. So likely it's just the insertion, although it feels like bicep, we're having the insertion right there. So this is going to be what we're dealing with right there. When we have that issue right here, that medial issue right in here, that's going to be more like a golfer's elbow, right? So golfer's elbow is going to be like when you irritate that middle elbow. Tennis elbow is like when you're playing tennis and you irritate the outer part of the elbow, okay? So we're going to use, what's best for that is soft tissue work, electronic stimulation, chiropractic adjustment. So on the video, we're going to capture mainly the chiropractic adjustment, okay? So let's have you, we're going to check your low back. Let me have you lay down there, face up for me. Face it up towards the ceiling. Good. Right here, without bending your knees, lift both legs for me. Hold them right there. Lift them a little higher. Hold them right there. Don't let me push down.
Oh, don't?
Yeah, don't.
Oh, that's kind of hard to do.
Is it tender or abs?
It's like a little bit in my lower back.
A little bit. Okay,
yes.
Lay your head back down. Don't let your legs hit the table. Relax them. Loosen them all the way down to my hands. When I let them go, you're gonna catch them. So loosen your feet. There you go. Any pain with that?
Not really.
Nope. Hold it right here and then leave your head down. Don't let me push down. Any pain with that? We definitely have some weakness.
Yeah.
Right? You feel pain in the low back when we do that? I'm gonna help you.
Yeah, just a little bit.
Yep, okay. Let's have you lay face down there so I can feel the low back here, okay? We've sprayed down the table. We don't use the face paper for recording purposes here, okay? Let's see, okay. We definitely have some issue here in the legs, a leg length issue. We're about half an inch shorter on the right side. So I'm gonna probably find pain more unilateral. Tender in here?
Yeah, a little bit.
In here? In here? In here?
Yeah.
In here?
It's more on the right side.
More on the right side?
Yeah.
Okay. So that would be consistent with the right leg being shorter, okay? So I think chiropractic adjustment's really gonna help you out. So what we're gonna do here is we're gonna get you, we're gonna use some lotion to get you loose. We're gonna adjust you, okay? So what is an adjustment? An adjustment is when we get into the joint and the segment and we increase segmental motion, right? A lot of times pain is gonna be a symptom that comes due to lack of segmental range of motion. So what are these? What does segmental range of motion mean? So segmental are vertebrae. You know what vertebrae are, right? The bones in our back?
Yeah.
We have multiple bones in our back that are supposed to move independently and 6 ranges of motion. So when I say segmental, I mean each little segment is supposed to move by itself, right? Now, they're not all supposed to just kind of, either way, they're supposed to work together to create motion, right?
Yeah.
So a lot of times that movement is restricted, so now you have like 4 or 5 things moving at one time. moving that one, and they're not moving independently. So it's not like a domino effect where they all move together, right? And that's how it should be. So what we do is we get into a chiropractic adjustment and introduce motion in there to create that segmental mobility. When we do create that segmental mobility, we decrease inflammation locally, and then in turn we decrease the symptoms like tight muscles, pain, so on and so forth. So that's what we're going to do today is get in there and adjust. So and you're how old?
I'm 18.
18, elbow pain, which I'm thinking is going to be more like of a golfer's elbow than a bicep, although you're feeling it up the bicep as well, but you're feeling that pinch right inside that joint. So we're going to use some active release technique here, electronic stimulation, elbow adjustment, low back, hurt during deadlifting, right?
Yeah.
I think we have a little bit of compression and lack of mobility in the low back, so we're going to use some lotions to get some movement, increase range of motion, segmental range of motion in the low back, and try to relieve some of the pain, okay?
All right.
After we adjust you, we'll put you on E-stem for a few minutes and go from there. Any questions?
Not really.
All right, cool. So we'll get going.